Hello, folks. Welcome once again to In One Ear, a show about living and learning in the age of dissonance. I'm Todd Weatherly, behavioral expert and treatment consultant, and we are broadcasting on WPVM 1037 LP, the voice of Asheville. It's my pleasure to be joined today by my friend and fellow Don Quixote, um, Jessica White. Jessica has been in behavioral health for 15 years, pretty close. She's a writer, a behavioral health and recovery advocate, an advisor, certainly to me, a truth teller. And she's got a hell of a recovery story that I think lots of people should listen to and should help advise the system that still hasn't figured it out. And so leads us to today's topic, which is meeting people where they are. Something that we are not terribly good at doing sometimes. So, Jessica, thanks for joining the show.
Thank you for having me.
So, you and I were doing a little pre-talk, and you were talking about meeting people where they are, but you were saying something about the strength of your recovery. Like you feel stronger in recovery now than you were when at another time when you met all the, checked all the boxes. Oh, I've been in recovery and been sober for 10 years and this and that and the other, but your recovery felt stronger after a different time because of the way in which you engaged it. I think this happens to a lot of people. I call it the 3-year mark for a lot of folks. Like they hit 3 years and they've reached the bottom of this bucket of content that is about sobriety and recovery and everything else. And they're smart enough and they reach in their intellect to the bottom of that well, and then there's nothing there, and because they didn't find something else, which is kind of a personal wholeness, and they relapse and they have all kinds of problems again and everything else. Because I mean, you can do a system for a while, but you better have, it's like a relationship, you got to have something that's got meaning that'll carry you through the boring times.
Right. I mean, and I think I've said this for 15 years that recovery to be sustainable has to be a lot more about showing people a life that's worth hanging on to when the going gets tough or just when the going gets boring, because we're not people that do well with boredom.
Right. Boredom's
But
almost worse, right?
oh yeah, I mean, I'll create a catastrophe so I can clean it up. And that is my story. It was like, I don't like this recovery story anymore. I'll burn the house down, start over.
Right.
I don't recommend it, but um, but I'm grateful for where I am today. And for me, I was a person in long-term recovery, and I would say a lot of that was based on kind of a CBT approach. Which is super effective as a quick intervention, but I don't know that carries you for life because it doesn't always get to what's underneath.
Yeah, it'll get you out of a jam,
Right. It's a quick intervention, and actually, I was introduced to CBT when I went to the therapist. I'm like, this is what's going on, and she was like, well, let's dive into that. And I was like, nah, I'm not trying to open all those boxes. I just need to be okay next week.
Right.
And so CBT worked really well for that.
Yeah.
But that long-term recovery stint was a lot like most of my life. It looked real good on paper. Like I was a straight A student who never went to school and was constantly in trouble and being threatened to be kicked out and that kind of thing, but on an academic scholarship. And
You're a walking paradox.
yeah. And when I look back at that first stint of recovery, it was a lot of that, of doing what I thought I was supposed to be doing and creating a life that looked the way I thought a responsible life of a recovered person should look. And I had this beautiful narrative with a bow wrapped around it.
Right.
And my news story's messy, and but it's real. And I think that's why I'm so happy today for the most part.
I started off in this field working with adolescents that were court referred from Charlotte. you're out of Charlotte, and
Hmm.
you work in the behavioral health industry there, and do some ground level work. And this client that came into the program I worked for was this is the irony. They were court referred kids from Charlotte, but he was from Brevard. Um, and we're talking about almost 30 years ago now. So I ended up running into him 23 years later. So I was his counselor, and it happens in the field. Like, you work with
Hmm.
people and you run into
Wow.
them again. And sometimes they're doing well, sometimes they're not, and sometimes they're somewhere in between or whatever. And it's always great to see them when they're doing well, they're working in the field, and they've got a good recovery story, they feel good about what's going on in their life. I love those. But sometimes you run into people and they're not doing so well. He's doing, he was had a job, and had a place to live and things like that. He had things in his life that we were in question as to whether or not he would ever get them at the time. And we sat down to lunch, and I was like, "Hey man, let me buy you lunch." He's like, "Man, I don't I don't know what I was there learning. I don't know what that was about." I was like, "I think we were all there for something, and it was not exactly clear, because we were supposed to be teaching you something, but I can tell you for a fact that all of us were learning." And he appreciated hearing that,
Right.
after a while. And so I think that there's this weird, you see it in mental health, you see it in hospitals all the time. There's this dichotomy. It's like there's the care provider and the expert, and then there's the people who need care, and they don't, there's this weird separation between these two worlds, like two streams that never cross one another. And I'm telling you for a fact that it ain't that clean.
Right.
And when you separate it out that way and you make systems look like that, that's when they make the mistakes that ours makes all the time, and that you've experienced firsthand. And on you're I one thing I always appreciated you is you're one of the people in that system that's trying to make it right, like trying to correct it and make it into something that actually works, meeting people where they're at. Not, maybe I don't know what you need. What do you need? Like, let me ask a question first, maybe. I don't know.
Yeah. Jessica White, making lives difficult for administrators and therapists for 15 years.
My people. So tell me a little bit, how do you meet people where they are? Like, I, I would I would regard you as a person who knows as much how to answer that question as I do. So please, I would love to hear your answer to that question. How do you meet people where they are, especially in the recovery world, in behavioral health, that people that are struggling and need help and don't know what it is?
Mm, Well, as a start, I try to never enter a conversation with a preconceived notion of what I'm going to do or where I'm going to direct this person. Um, and it is
Hold
like
on,
you
let me write that
said,
down. Hold on, that sounds great, really good, actually. No
I'll listen later
preconceived
and jot
notions.
notes for a future book. But
Right,
yeah,
exactly, exactly. Well, yeah,
um,
which one of us is writing it? If I'm writing it, I need your help. If you're writing it, I'll throw tidbits, but
I think it'll be a team. We should do team
we should
efforts.
do a team effort. Yeah, you're definitely the writer in the group, that's for sure.
Yeah, I just get excited when I'm articulate speaking because,
Right. Well,
usually
now
things
we've
come out
recorded
way
it,
better
so
writing.
awesome.
Yeah, big win today. Um,
Uh,
but like you said, it really is just listening to people, and some of the things, some of the attitudes that I've found that have crept into our industry are things like when clients put up a negative review or AMA that, well, they didn't want treatment, they didn't want to get well, they just wanted a drink.
mhm.
Well, they're an addict. I'm like, that's my favorite one. They're an addict. So we're going to discredit the people that we're in the business of serving. You know what I mean? Way to go for stigma reduction, folks.
Right. People will save their egos over saving the people, like, that they work with. That's true.
Yeah. And so, and what I've found with every client that has had a negative treatment experience, and that's why That's why I do call you all the time. And we do kind of staff cases to try to find the very best fit for this person, not Todd Weatherly's favorite program or Jessica White's favorite program, but what is the best fit for this person with this whole bag of stuff and this whole human and this whole life? And what has their experience been previously? If somebody, whether it's accurate or not, if someone's perception is that they felt beat up and not welcomed in 12 step, I'd say let's not send them to,
12
a
step.
place that's majors on 12 step. Who knows? A lot of people, if you do meet them where they are, will find their way back to other programs. In fact, I was listening to a Dharma talk by the guy that started Refuge Recovery a million years ago, and he was talking about he started it on a resentment against Alcoholics Anonymous. But because of the work that he did in Refuge and the work he did in his own recovery and spiritual program, he became open to what he could gain from Alcoholics Anonymous.
Right.
And I think that's the whole thing. Like, let's not be so quick to say that MAT is bad for everybody, because one, it's not bad for everybody. It's absolutely necessary to save some people's lives so that they can maybe get to abstinence-based recovery. And some people thrive and do really well on 8 milligrams of Suboxone for as long as they need to do that. And that's not my business. I'm not a physician. I don't think that should be a therapist's business. I don't think that should be a sponsor's business.
And it shouldn't, and it also shouldn't mean that they, they get rejected by a group. You're talking about somebody who's taking a medication, a prescribed medication, not to say that those can't be abused, because they can. You're talking about somebody who's taking a prescribed medication, but if they walk into an AA meeting or an NA meeting and they share that information, chances are incredibly good people are going to be like, well, they're going to pitch them aside.
Mm-hmm.
I mean, there's a lot of groups that will do that because they don't believe that that's clean. It's like, well, how many here are on antidepressants? Does that mean you're not clean? And I think that we fall into these traps, right? This is the answer. And I need, and especially for people who cling to a specific answer and it works for them, for that not to be the answer for someone else threatens how they've construed and used this answer, quote unquote. And suddenly there's a dyad. There's this competition. It's like, well, I can't entertain questions about the way that I'm doing it because I need to keep my head down and I need to keep focused on it. I get that. That's real. Somebody's really dogging it out to be in recovery and they're following a model and they're following a system and it's working. You don't want to interrupt them. And I get that. But at the same time, you translate that to, and this is the way we should provide care. And all of a sudden where you are is you're putting a square peg in a round hole and they keep not having the help that they need and falling to the bottom of the system. And in that way, if you're going to be a person who's receiving care and you want to do it your way, great. Find a way that works and do that. If you're going to be a person who's offering care, you need to be able to entertain a variety of ways in which people might receive the help they need. And if we don't get that, this epidemic that we have in addictions and the rising mental health crises that are happening throughout the country, it's not going to get better. It's going to get worse. So, like, the truth is, we actually know how to do this. We can do this. I just don't understand why we don't.
I do feel like more and more people are coming to think in a similar way to what we're discussing now, which is refreshing for me. I mean, there's still a lot of the old guard, but God, I think you and I clicked so much when we met probably 10 years ago because we were total outliers.
Yeah, we ran into each other in the periphery.
Right.
What are you doing out here in the periphery?
Out in the leper's den, Todd and Jessica.
I know why I'm here. Why are you here?
Right. But I was a personal trainer for a while, and it always struck me like or, if you look at physical health, we would never prescribe one diet for everybody. Like, we know
Right.
keto has been amazing for a lot of people, or what can have all the hype. Atkins was amazing for some people. It doesn't work for everybody. Everybody needs something different. If I prescribe the same workout routine for a woman in her 50s as I did for a 25-year-old male athlete, then I would have been laughed out of that industry. So I find it really interesting that, we get this when it comes to nutrition, that every person is different and everyone's going to respond to diet, exercise, and everything else in a different way. But when it comes to brain disorders, we've had a harder time understanding that we might need more than 2 treatment plans to choose from.
Right.
So.
Well, let's talk about one of the major culprits. I was like, I know that we can do this, and I don't know why. That's not actually true. I think I have some idea why, though I don't know the complete answer. I think I know part of what the solution is. Where to start can feel a little daunting, but one of the big culprits is money. I mean, it is. It's just money. So why do we have this scripted method that we try to put on everybody specifically? Not that there's only one method. There's a variety of methods, but they have to fight for their territory to be included. And a lot of what you see out of the treatment world has been designed to address what insurance companies will pay for. We got to be able to, it's got to have a number, and it's got to have a category, and it's got to have a treatment period, and it's got to have all these things, so that we can turn it in on insurance, so we can turn it into our insurance, and then they can deny our claim, of course, because they don't, even though they're supposed to pay it, and technically, legally, they've been told that they have to pay it, they're going to try not to pay it.
Right.
So we see that all the time. But anyway, here's my method, and here's the system that I've designed. Yay me. And I did a lot of hard work, and it works. And so we're going to use it on everybody. And I don't want anybody to tell me that there's another system, because that threatens my piece of the pie.
Right.
And no one is more guilty of that than Big Pharma. Oh, did I say that out loud? I'm sorry. No,
I love that.
Big Pharma.
The industry that handed us the addiction hands us the solution. Imagine that.
You can't be prescribed. What was it in the 80s? You can't be prescribed something, a medication by a doctor, and have it, and then have an addiction to it, because you can't be addicted to something that's prescribed by a doctor.
Oh, lovely. Yeah.
And that's we had to come off of that definition, and we're still in the throes of the opiate epidemic, because when you walk into the hospital, they're still going to throw 40 pills of codeine at you, or oxycodone or whatever. They still haven't caught the clue. You still got psychiatrists and doctors all in the hospital that still haven't caught this clue. It's like, stop giving this to people if they don't actually need it.
And I'm friends with several physicians, and I've been really shocked, or I was shocked years ago, to learn how little of their education was devoted to anything around addiction and substance use. And they also tell me that a lot of their education about new medications comes from pharma reps. The pharma reps' number one goal is to develop a lifelong relationship with a patient. That's, so many best practices are written, like, well, we lowered your blood pressure, so best practice is that you take this medication forever.
Right. Well, and I see it all the time especially with kids now. So you've got parents that are having a hard time parenting, and for whatever, the situation at home has become very difficult and unmanageable. They're getting kicked out of school. They're having all kinds of problems. So there's no support, and there's no containment around the behaviors to help them develop to do a behavioral approach to correction, to getting back on track. And maybe it's academic, maybe it's behavioral, maybe it's both. But they don't have these what we might call soft supports helping them get back to where they need to be, so they're not trouble at home and trouble at school and trouble everywhere else. So
Right.
what do? We use the tool that they have access to, and that's meds. So you end up with a 13-year-old on 5 psychiatric meds, and he's still blowing it out in the classroom because he hasn't learned one behavioral skill, not yet. Not from the
Right.
teacher, not from mom and dad, not from the therapist, not from the doc for certain, and not from ultimately anyone else. Because you've got a school system that's going to try and dodge responsibility for providing any kind of measures of accommodation. You've got
Hmm.
docs, and they've got one tool. So, and they have a tendency to be very arrogant. Finding a good psychiatrist, in my view, is challenging to do. The good ones are worth their weight in gold, and
No
I,
kidding.
I love them dearly. But they only have, if you all you have is a hammer, you tend to treat everything like it's a nail.
Exactly. Well, and again, I mean, it's a broken healthcare system. I mean, physicians
Is it
don't get to
broken?
spend
Was
the
it ever
time to.
fixed? Did we? Was there a period of time when it worked? Because I'm not aware of one. People say it's broken. I'm like, it was never worked. It's never worked. We don't. We've
Oh,
never had an operational system. Not
you
yet.
mean it was always scotch taped together?
It was always Scotch tape. We're always just kind of making it up as we go along, pretending like we
Okay.
were. Yeah, exactly.
So there was no golden age of healthcare in
No, not.
America.
I mean, please. If anybody's listening to this podcast, please correct me if you thought that there was an actual golden age of mental health care. There may be little pockets here and there, some movement that happened. You know, Timothy Leary may be like, "Yeah, I had it sorted out," but
Right.
me and Ron Dass, we were working out the great questions of the universe. That's where it all should have ended up in the first place. I'm like, maybe I get that. Hey, I'm not going to
Right.
discredit that at all. I believe that's great, and yet there's a whole world of care out there that's needed, and we haven't done it right yet. So
Yeah, you're right. It's always been disjointed. And, a lot of the administrative rules and efforts to make it more streamlined has failed abysmally. I mean, and what it's done is create so much work, administrative work for physicians. And that, like, to circle back, I think healthcare representatives today don't have the time to spend with patients to get the full story. It's like they've got a few minutes because they have to do 30 minutes of documentation to make sure that the hospital or whoever gets paid for that service.
can we just take? I just want to hear that statement again. Healthcare representatives, people who are supposed to care for other people, don't have time to care for people.
Right.
Don't
I
have the
mean,
time to do that.
I intentionally see physician's assistants instead of doctors at
Oh yeah,
everywhere that I go regularly because they do spend the time with me. They do know me. They do hear me. um, but I know some fantastic doctors and psychiatrists and all those things, but it seems, to be more the trend system wide that there's a lack of time and you know, again, back to the original point, clients and patients aren't always heard. Um, I have less trouble advocating for myself than some people. So if I feel like a doctor doesn't hear me, then I'm leaving. I'm going to get a different doctor.
oh yeah,
Um, but it's not that simple when it comes down to behavioral health and mental health treatment and options.
yeah. Well, I grew up, so this won't shock you, but my mom's a nurse,
Mhm.
and I grew up and worked for doctors' offices and everything else, and when I was a kid, and so I grew up. If I had to go to if it was me going to the doctor, and the doctor was not a doctor that my mom knew or had some relationship with before, it it took all of 5 seconds for my mother to be like a doctor would be holding a clipboard, and my mom would be like, "Give me that," and take it out of his hands. She did not care who you were or how important you thought you were. She was going to hold you accountable. She was going to look and know herself. And that was the lesson at a very young age. I learned, don't let these people expert you into ignorance about your own condition. Like, know what's going on, know what they're saying. If you got a question, ask it. Be ready to advocate for yourself. And if you want to, if you're not interested in the remedy that they've suggested, be willing to walk out of that office and go get another opinion. Like, I had all of those lessons like really early on. So naturally, what did I become? What is essentially a healthcare advocate? Be like, I'm just another version of my mother in that scenario. Like, give me that piece. What are you doing? I don't care how many degrees you have. That doesn't, no, that doesn't mean, that doesn't make any sense to me at all. This is my imaginary conversation with doctors. I've had that conversation with a doctor. It's like, I don't know where you think, what you think is going to really actually help this person, but what you're saying is completely off base. And I don't care whether you've got a PhD or not. I really don't. And sometimes that's what it takes. It's like it's almost like they snap out of this fog. It's like they don't like it, but I mean, I
Right.
think we, as a system, we kind of need to get snapped out of the fog. I don't. I'm not saying that I know everything either. Like, please ask
Mhm.
me a question. It's like, no, no, that's not. I don't think that's right. I'm glad to listen to somebody who feels like they've got a good beat on something, and knows how to ask good questions. So you got to have both. It's like being an expert is also what being hard on your own opinions
Right.
and
No, you're
humility.
right. And like this may be flashback to it's unrelated but related, but one of the best doctors I ever had was my general practitioner. And he was also like a known recovery guy. So he was a good person to go to early in recovery. But
Right.
I went to him because I started having panic attacks at 5 years sober, and I'd never had a panic attack in my life. And they were debilitating, like blood pressure through the roof, like blurry vision, like not being able to not cry. Like it just was, I didn't know what was happening to me. So I go to him and I'm thinking I'm going to get a medication for anxiety attacks. And he's just chatting with me about what's going on in my life. And he looks at my hand and said, "How long have you had that ring on your finger?" No, first he said, "How long have you been having these panic attacks?" And I said, "3 months." And then he said, "How long have you had that ring on your finger?" And I was like, "Oh my God, 3 months." That doctor saved my life in more ways than one, and he didn't cure it with a
Wow.
script. Um, so there are excellent physicians out there, but I think that illustrates exactly what we're saying, like how much it matters whether you're the person getting the first call from a family member or a client, or whether you're the physician or the therapist, to just take a minute to get the whole story and set aside, like, this is how we treat anxiety attacks. Um, but to figure out what's going on with this human in front of you.
Yeah, I think you're talking about seeing people as whole people.
Right.
Like, hey, wow, there's a what is it in Swahili? It's a there's a term called sawu. They greet each other and say sawubona, which means I see you.
I like that.
I do too. Yeah, like it's I see you. And that's the thing that you and I've always had. We get each other and we see each other immediately. And I think that's missing. I get why to a certain extent because people have intense conditions. People are sick and they have stuff going on, and you've got to maintain a level of separation from that stuff because it can be very impacting for you. So I mean, I think it's a special kind of person. All people who do things in the world are special kind of people. Trust me when I tell you, I'm very appreciative that people cut hair because I would be terrible at it. And I need somebody else to do that for me. And I appreciate it dearly. And then there are other people who do behavioral health, and we know how to live in the world, and we know how to not let that crap have an impact on us when it is crap, when people they got a bunch of junk and they need help with it. So I'm not going to
Mhm.
take that on board, but I am going to help you get help for it.
Right.
And it's the special kinds of people that have that chemical mix that allow them to do that. Others who can't do it, they get sick because of it, or they enmesh with the condition, or they do these things, and it's like the right people in the world doing this kind of work is one thing. I think the other thing is that find the work that you need to do to get help, whatever kind of help it is, and do it for long enough. you know. The worst
Mhm.
thing we do, medical and otherwise, is to like get help and not have somebody in front of us have somebody in front of us who can't see us, first of all. So getting help that isn't the appropriate help or isn't going to do us the right service. But then there's also, let's say you get the right help, and then people like, oh, feels better now. I guess we can stop.
Right.
It's like, wait. Here, let me tell you, um, personal growth and development is the only thing that you're here to do. You can do all kinds of other things, but your own
Mhm.
personal life and living development, like becoming a better human being, is really the only game in town. And it's for all of us. Doesn't matter whether you got a condition, quote unquote, or not. It's for all of us. We all got the same goals. We want to live as happy as we can, have meaningful work, have good relationships. Like I don't think our goals from between one another are all that far off, honestly.
No, you're right. There's no graduation like, well, I'm well
Right? There's the
now.
graduation.
And I say that to people all the time, I mean, mental health, just like physical health, any part of health, it's on a spectrum. And we don't stay like, oh, I'm a 7 and I'm a 7 forever. That's my number.
Right.
Things happen internally, things happen externally. Sometimes we cope better than others, but wellness is on a spectrum.
Yeah.
And recognizing
Resiliency
that.
is what you're after, right?
Absolutely. And, one thing that I do try to do with every person that I encounter before I connect them with any treatment resources is to talk to them about how important what they do after is going to be and how important it is to get connected. And, if I hear like, oh, well, bias towards 12 step, I'm like, well, fantastic. There's also refuge recovery. There's also rational recovery. There's also all
Smart. All
recovery
those.
meetings. Which one can I hook you up with? Because we know ultimately it doesn't matter what school of thought you're reading. Really, a huge part of the antidote is some sort of connection and support. And for me, that was the hardest lesson that I've ever learned, is that I actually do need people. Because I grew up very much in a family where it's a badge of courage to pull yourself up from your bootstraps. Like, I mean, my mom's favorite thing to say when I was like from 3 years old on, anytime we were upset about anything, was build a bridge and get over it. She thought
Right.
that was so clever. But that was the mentality that I was carrying when I was in my late 30s. And, like many things, what may serve me in some moments ceased to serve me well at 35.
Right.
Because I
You
built a
ran
lot
out.
of bridges and I didn't know how to get over anything anymore. Like, my bridges were looking real bad. Like,
Well, you kind of addressed several things there that come to mind. Like my background's in education as much as is in behavioral health. There's a thing in education. It's like if you try to ask, do you have any questions about what we're learning? It's like, well, technically speaking, you got to have command of about 75 to 80% of the content of the topic before you can even formulate a good question.
mm,
So we're saddling people who are fresh in recovery with this. So what do you need? It's like you don't know what you know. You don't know what you don't know.
mhm.
And unless you've got somebody there who's kind of walked that path, which is why not only, like you say, community is such a big deal, but also having someone who is a sponsor or having someone who is a peer guide or a mentor or, someone who's kind of been to the other side of this. It's like you need to think about asking some of these questions. And you're going to run into this wall. And these are some things you're probably going to experience as part of this. And you just got to be able to, like, some of it you're going to have to shoulder, some of it you're going to have to muscle through, some of it you're going to need real support from. Find somebody to be that support for you. Like they don't know what to ask. You got to give them information. And so, and in addition to that, like if it's coming from a doc, it's like, well, this med, this med, this med, this med. And if all they know is meds, they're only getting one subset of information. They're not talking about their lifestyle and finding community and finding a good meeting and finding a good peer support person or whatever it is. It's like there's a domains approach, there's a living life that goes to recovery in general for all of us, regardless of
Mhm.
what the condition is.
Right. So, we've heard it 1,000 times, and in this industry specifically, I hear it said more than I see it done. But, the whole concept of discharge planning should begin on day one, but it should. And that's the part that I always really appreciated. And, like we were saying earlier, we both know fantastic psychiatrists. We both know fantastic physicians and therapists. And so, I think we're fortunate that we can be part of the solution and not just look at like, well, here, can you and I, further scotch tape the system together? Probably not. But can we continue to build a community of like-minded professionals that agree that, hey, we're going to meet the client where they are? And I have a list of 17 fantastic therapists in Charlotte. And so I found that if I take even 15-20 minutes with a client, I usually am immediately like, oh, that's
You need to meet this person, right?
that's this person. And then the next person, I'm like, oh no, that's not a perfect fit there, but it's going to be a great fit here. And I throw it out to them and I get their buy-in by telling them about this therapist that I know and what I know about them. And so now when I'm getting people in treatment, I usually have them connected to a therapist before they enter treatment. Um, and so they're more likely to do that than if we get them in treatment and then say, go see this therapist, even though you're feeling well now, you're looking better, you're feeling better, you got your 30-day chip. So, I think those are the things that we can do and that we do that really do make a difference, is listening to people. If you have a bias against, I keep picking on AA. I love AA, but it is something that I hear often from clients, and it's not my job to talk them into why AA is good or a good fit for them. I listen to them, whatever they say. I usually tell them it's not the first time I've heard it, because it never is. And then I offer them other alternatives. And so, I had my own beef with AA for a while, and now I love AA. And now I can find the good in it. And, whether it's approved thinking or not, I kind of take the Al-Anon approach of take what serves you.
Yeah. Make it your own.
So yeah, if somebody's grandstanding and I don't appreciate what they're saying, for me, it's real easy to be all or nothing and throw the baby out with the bathwater and let these three people that I disagree with represent all of it. I mean, that's no different than letting a religious leader represent an entire religion when he,
may or
has
may
a
not.
following of 100 people. I mean,
right.
Sorry, I can't believe that you're God's spokesperson, this one person, and then put that, so that's some of the stuff I've done personally that's really helped me in the last few years, is realizing like I can take what serves me and there is a lot of good here, and what I don't appreciate, I can just kind of leave. Or if I don't like this meeting anymore, I could go to another one. There's 300 in Charlotte right now. Like,
well, thanks for bringing us around to a positive note as I was complaining about all kinds of things.
that's what I was pointing out. Like, Todd, come on, I'm known for being such a Pollyanna.
You like to sugarcoat it, right?
Oh yeah.
Yeah, totally.
No straight salt.
Well, feel certain that we could do several more of these and keep going on this topic. I just love hanging out with you, Miss Jessica, my dear friend
Likewise.
of now many years, and I'm so grateful to have you as a guest on In One Ear today. And we're going to probably invite you back so we can do it again. But until then, thanks for listening on WPVM 1037 LP, the voice of Asheville. This has been In One Ear. I'm Todd Weatherly and my wonderful guest, Jessica White. Thanks, Jess.
Thanks, Todd.
Bye now.
Bye.